Good afternoon. My name is Julie Westendorff. I'm a La Plata County Commissioner, and today is May 8th, 2020. We are now close to 2 months into our response and life in the world of COVID-19. Joining me today is Liane, Jollon, who is the Executive Director for San Juan Basin Public Health. Hello, Liane. What's new in your world?
Well, I think lots of folks in our community are aware that we are Safer La Plata has moved into the next phase where there will be some retail businesses adding to their curbside retail, a little bit of in-house retail with some very strict infection control procedures in place. And then there is an addition of personal services like salons coming up this weekend. And then next week, some small businesses or small steps businesses can add individuals to their workplaces. So some of the activities that have been prohibited for over the last month are now coming on. And with that, San Juan Basin Public Health is working really hard to ensure that we have good early warning systems in place as these new activities start very slowly in the community. So one of the things we're doing is we did a recent update to our dashboard. We will be doing another round of updates, and next week on that dashboard, we will be reporting total number of tests in the community as well as positive cases so that people can really benchmark what our positivity rate is and get some more data about trends of spread of disease in our community to ensure that as we take these steps, we are doing it very safely and very carefully and continuing to save lives.
So can you just simplify what you said and tell us why this positivity thing matters?
Well, what it matters is, people have asked this question for some time, which is how many tests do we do locally? So this new information on our dashboard will show how many tests are happening in our local communities each week. And then what the total number of tests in our communities have been over the course of COVID-19. And then the positivity data is a piece of information, which is what is the percentage of tests that are coming back positive in a community. So one of the things that epidemiologists look at is that if a high number of tests are coming back positive, there's a good chance you don't have enough tests in your community. So you want to actually see that number of positive tests lower over time to both show that your transmission is starting to get under control and you have enough tests to make sure that your sample size is telling you good information about the tests that you have.
So do we know whether we have enough tests available now to be relevant?
There is some data. There's an idea that across the country we need to test 150 people per 100,000 everywhere every day until we move into a controlled endemic burden of disease. So with that, we do believe here in this community we are able to do what our version of 150 tests per 100,000 individuals is. So that puts us in a really good spot to track disease.
That's good news, and it's the first time we've heard news like that ever on this topic. I wanted to ask how I'm assuming that those kind of tests will give us an impression of what health impact the outbreak in northern New Mexico will be having on our...
So we do know that here north of the state line between Colorado and New Mexico, we are demonstrating small numbers of active cases and less transmission. And then in northern New Mexico, we are still seeing high rates of transmission and high numbers of cases. So it's important in this community as we are taking some steps, moving into Safer La Plata and Safer at Home Colorado, which does allow for more activities that we carefully track if our disease transmission changes in this community.
So what you described to me sounds like if I saw some ice, I would go out baby steps to see, is the ice strong enough to hold me? And I might wait a few minutes at this spot before I try and take my next step. So I'm hearing baby steps, and we can take baby steps to see really where we stand as regards to the pandemic.
Yeah, I think that's a great analogy. We're kind of testing it as we go, and we have to be careful. We worked really hard, for over a month in a stay-at-home order, And this is not the time to undo all of that work.
So you're talking about some businesses being able to open in either somewhat when they've been closed before, or some businesses maybe being able to expand what they've been doing. Can you talk a little bit about the timeline for that? What businesses open sooner and what businesses open later, and so on?
Well, here in La Plata County, we kind of did one set when the governor issued Safer at Home that applied to curbside retail, that added in a little bit of real estate, just one-on-one showings, not open houses. And then it added in some medical and dental that people hadn't been able to do during the stay-at-home order. So we then kind of slowed things down for a few days because the next set of things were going to come on May 1st and May 4th. And we said, let's just get them all coming on together on May 8th and give everyone a little bit of extra time to learn what their infection control measures should be. And so that the other things that are opening now are limited retail and then limited personal services. So that's salons, nail salons, massage, body art, that type of thing. And so all of that came on together, including some offices could go back to uh, smaller occupancy, but have more people in the office than they'd had in the office previously. So all of that is happening right now, as long as businesses go through a self-certification process where they go to the website, they read the guidance for their type of business, and then they check off
Excuse me, go to what website?
They go to the San Juan Basin Public Health website, and on the website, there's a form that links to all of the guidance for that type of business. And so what we're asking businesses to do is go to our website, click on what type of business you are, go through the form, and then just attest, I've read it, I have the supplies, my staff understands it, and we're going to proceed safely. And so if you're a patron of one of these businesses, you should expect to see when you're trading at that business that they are following these standards pretty carefully.
What are some of the things that a customer might expect to see?
We would see staff members with face coverings. We would see staff members not clustering, but also, remaining more than 6 feet apart. We would see people with frequent hand washing, frequent hygiene within the business. We shouldn't see people at work who are symptomatic, and we should see frequent sanitation of any high touch area in the business. So as patrons, this is what we should expect to see. And then many of the businesses are asking us as patrons to also make sure that we are covering our faces and not spreading, our germs when we go in. So the idea is, we're all in this together. If you walk into a business and you see they're doing all of this right, they're doing that to protect you. You owe it to them to protect them by also going in with your face covering, washing your hands frequently, and limiting your trips to things that are really important. This is not the time to be browsing in stores and, doing unnecessary activities. It's still very much, you should only be doing it if it's essential.
And it seems to me that curbside delivery is still occurring for most retail businesses, grocery stores, and the like, so that at-risk people can continue to phone in their orders and take advantage of those services.
Yeah, we've heard, some retail is only going to do curbside. They're not going to take this next step. We've heard from plenty of businesses that they're not ready to go any next steps, that they still want to wait and make sure that they're keeping their employees safe, keeping themselves safe, and not spreading infection to customers. So again, the reason that we did it slowly was to give everyone a chance to really learn what it would look like and make the best decision that they could. And it's not every business that's opening, not by any stretch of the imagination. People said, wow, I have a big responsibility to not spread infection, so I'm going to move slowly. And that's okay. As a community, we have to kind of get this right. We don't want to do it too quickly and then have to go all the way backwards.
About how many businesses have gone through this self-certification process so far that you're aware of?
As of this morning, we had 440 businesses completed, and I did hear that we reached 500 at some point today. So, we've heard a lot of businesses got that this was an important step. The staff's comments were, wow, this community really is taking this seriously. People are giving very thorough and thoughtful answers about how they will keep themselves safe, how they will keep their employees safe, and how they will work to keep their customers and patrons safe. So La Plata County really put in a big effort this week to make sure that face coverings were out in time for this transition.
I was really pleased with the work that our Emergency Operations Center did this week. That's where needs of the community from different departments and agencies are shared. One of the needs that came forward was, hey, if businesses are going to be open, employees need face coverings, and there's something that's kind of hard to find right now and not cheap. Just through work with the Business Improvement District and the Chambers of Commerce and the Emergency Operations Center, we were able to deploy free of charge some old snowdown face coverings, buffs from a few years ago around the county. So they went out to Ignacio, Bayfield, Vallecito, and Durango. And that was just something I was really pleased the community could provide to help businesses get open.
Yeah, and we also want businesses to be able to give them to customers if customers are out trying to enter business. It's just the business is saying, I'm going through all of these extra steps because I care about your health. We're asking the patrons to reciprocate. And so some of those face coverings went to businesses to ensure that they could give them to patrons if they wanted to do business there too. So,
well, thank you, Liane. I again appreciate you spending your Friday evening here with me for a few minutes and for sharing an update on what San Juan Basin Public Health is doing here. And we're looking forward to our economy getting back in motion, and hoping this, once it takes off, it continues going forward and we don't have to take any steps back. But wash your hands, don't touch your face. You know all the rules now. Like my grandma said, wash your patties.